Hi, I'm Vince.
I'm Ashley.
I'm Pega.
I'm Stephanie.
I'm Justine.
I'm Aiden.
And we are Team 4.
In the case presented at the beginning of the chapter, you are a consultant to a 40-year-old pharmacist and you have been asked to provide Darcy with some advice on whether she should integrate an automated dispensing machine and web-based patient safety program into her community pharmacy practice. For the past 10 years, Darcy has developed a thriving independent community pharmacy practice in a rural community of 3,000 people in the Midwest state. While the trend toward an increasing number of prescriptions being transferred to a web-based and mail-order pharmacies are a competitive pressure for most community pharmacies, Darcy's pharmacy has been affected at a relatively low level, less than 10%, due to her loyal customer base combined with her ability to offer competitive prescription pricing. In the last few years, Darcy's pharmacy has experienced a large increase in medication dispensing errors. Darcy has difficulty recruiting a pharmacy technician, and she is considering buying an automatic dispensing machine to assume part of her increased dispensing load. Darcy is also considering a web-based patient safety program in the next 6 months. She would like to make sure there are no other issues to resolve before she proceeds with these 2 projects. What should you advise her to do?
Telemedicine is defined as the use of telecommunication technology to provide healthcare in a cost-efficient manner and to improve healthcare, particularly when distance separates the healthcare consumer from the provider. The use of telemedicine broadens access to medical care, health education, and health service delivery for at-risk populations. The amount of errors that occur in drug distribution has played a large role in the creation of new technologies to decrease such risks. Studies have shown that the most frequent adverse reactions were due to incorrect medications or the incorrect dose or strength of the medication given. Nationally, about 7,000 deaths occur per year due to medication errors, with the overall dispensing accuracy rate being 98.3%. With errors at such high prevalence, a greater amount of technology is being incorporated to decrease this occurrence.
Encouragement of an increased use in technology is sought out by acts such as the American Recovery and Reinvestment Act, which provides this continued investment needed to increase economic efficiency by encouraging technological advances in science and health. $19 million were set aside for incorporation of health information technology in hopes to optimize electronic health exchange to improve individual and population health. Technology already has extensive use in the health field, gaining practice in topics such as drug interaction, monitoring therapy, drug distribution and dosing, financial analysis, inventory control, research, product development, quality assurance, business development, as well as marketing and sales. While it is already finding use in multiple aspects of the health field, it is still continuing to grow, and with such increase, it is necessary that proper training is given to the health professionals in order to effectively use it. It is important that informatics is now included into the pharmacy school curriculum, as well as being included into continuing education programs. Education on the use of new technologies will better improve its use and efficiency in the health field.
One of the most significant incorporations of technology into the health field is the use of electronic health records, EHRs. The EHR is a record of every healthcare encounter an individual has. It contains information such as patient demographics, provider notes, medications, medical history, laboratory data, and other test reports, and is important in clinical decision-making, outcome assessment, and quality management. The use of EHR provides healthcare professionals with an easy access to all of a patient's health information, as well as providing a connection with other health professionals. Not only does it provide professionals with an easy access to information, but it also saves a large amount of money due to increased safety, efficiencies, and more effective management of chronic diseases as well as disease prevention. It has been suggested that between 2005 and 2020, the EHR system will result in a net savings of $371 billion for hospitals and $142 billion for physician practices. Another positive aspect about the EHR is the ability for patients to connect to their own health history through a patient portal, which gives them access to their own EHR. The patient portal provides the interaction between patients and healthcare providers through giving patients better knowledge on their health and allows for prior preparation before health visits. Patients are more satisfied being involved in their own health, and it helps to create the best outcomes for that individual.
Along with the EHR, electronic prescribing is one of the biggest trends to hit the health field and is in the process of becoming the only option for prescribing due to its high efficiency. The use of e-prescribing provides a way of getting a prescription to the pharmacist in a matter of only seconds without having any third-party influence, such as putting the prescription into patient hands. Not only is e-prescribing time efficient, but it also greatly decreases the potential for medication error. It is often difficult for pharmacists to interpret the handwriting of the physician, creating the potential for misreading it, while e-prescribing removes this barrier and provides typed versions. It also includes built-in software that instantly runs drug utilization review, searching for drug interactions, adverse reactions, duplicate therapy, and drug-to-health state verification. Using this system greatly decreases the risk of death from prescription error. It has grown in interest to such a significant amount that under the Medicare Improvements for Patients and Providers Act, physicians are given financial incentives such as payment bonus if they use the prescribing system, as well as a reduction in pay for those who do not.
In this case, Darcy emphasizes her struggle to find reliable workers for her pharmacy, which are necessary to keep up with the high demand for filling prescriptions. A solution to this issue is through the use of automated dispensing systems, which positively affect the time and accuracy of dispensing drugs. This technology uses the unit dose cart filling of patient medication cassettes that are then checked through a barcode technology. This decreases the amount of time pharmacists, as well as their technicians, spend counting out medications and frees them up for other aspects of patient care. While this system is very efficient for dispensing drugs, it is essential that information is entered into the computer system accurately for the correct dispensing of the drug. Advantages that the automated system has over humans are that it can work around the clock without fatigue, it does not receive any employment benefits, and it typically does not have dispensing errors. Another feature being incorporated into dispensing is the addition of a barcode on the label that ensures medications are being given at the correct dose at the correct time and to the correct patient. This system limits the amount of medication errors that may occur, especially in hospitals when pharmacists are not always available. Studies have shown that this system has been effective in increasing patient safety, improving delivery of care, and reduced length in stay due to a decrease in adverse side effects.
Technology has provided a better means for the distribution of drugs through connecting all health professionals involved in the healthcare of a patient, decreasing costs, giving easy access to information, providing better time management, and overall decreasing the amount of drug errors that occur. It would be in Darcy's best interest to incorporate items such as automated dispensing devices, electronic medical records, e-prescribing, and barcoding into her practice. While these items require knowledge and training to use them efficiently, they prove to be worth investment.